Hello viewer, you are welcome to Health Issues with Dr. Paul Noble. Today we are going to look at another episode on kidney stones, and our topic for today is myths on kidney stones. There are quite a number of beliefs people have about kidney stones and the treatment of kidney stones that are not true. As far as the word true is concerned, they are not true. They can be misleading, and they can lead you into having serious problems. So that's why it's very, very important that we talk about them right here and now. Kidney stones are just generally hard deposits that form within the kidney that can obstruct the kidney, cause pain and other symptoms, and can lead to the damage of the kidney. What are these myths? Number one myth is that hydrotherapy, that is taking a lot of water, can be a form of treatment for all stones. That is not true. For small stones, taking a lot of water can help the passage of small stones. But for larger stones, taking a lot of water will not be a solution, because no matter how much water you take and keep on taking and taking, large stones will not pass. And the only thing that will happen is that with time the kidney will just get damaged. So if you have a kidney stone, it is actually the job of the urologist to assess you, look at the kidney stone, the size of the stone, the position of the stone, because where the stone is in the kidney is also a very major factor to determine whether the stone will pass out on its own with water therapy or not. So water therapy is not a solution for all types, sizes of stones. Number two myth is some people believe that taking beer, alcoholic drinks, can help prevent formation of stones or help in removing stones. That is also not true. Alcoholic beverage can be a form of fluid, but that alcohol, talking about alcohol in itself, helping to prevent or helping to flush a stone is not true. Another myth is a belief that cranberry juice can help the dissolution of kidney stones. That is also not true. Yeah, some studies have shown that for people with infections, recurrent urinary tract infections, that cranberry juice can be of help, but not for people with kidney stones. Another myth has to do with use of drugs, what we call a medical or stone dissolution therapy. Use of drugs for the dissolution of kidney stones. It is not all stones that are susceptible to this. As a matter of fact, 80% of kidney stones are mostly calcium oxalate or calcium phosphate stones, and this group of stones cannot be dissolved by any form of therapy. No matter the drug, whatever drugs you are buying, whether you are buying from distributors, you are buying from the pharmacies, or you are buying from people that do chain businesses with some form of drugs or herbal therapy, there is no dissolution. There is no chance that those stones will disappear with any of those things. So it is only small cysteine or uric acid stones, small ones, that is in about 20% of cases, small uric acid or cysteine stones that can be dissolved by this medical dissolution therapy. And it is the urologist that will know the appropriate therapy to give you, not just going to the market or going to anybody that is doing one thing or the other to give you anything to take. There are proper medical dissolution therapy that we can give where it is indicated. Another myth is that what we call shock wave lithotripsy, where you apply some form of waves to the skin close to the area of the kidney. Shock wave lithotripsy can help in treatment of all stones. No, shock wave lithotripsy can help in certain stones. So generally these are the myths, some of the things that people believe in about kidney stones, but are not necessarily true. If you have a kidney stone, visit the urologist, visit us. We'll be able to direct you on what to do. We'll look at the size of the stone. you know, one of the problems that we've had is that some people they will have stones, and they will keep on doing ultrasound upon ultrasound, and they will keep on being told that keep on taking water from month to month. The stone is reducing in size, the stone is reducing in size, and before you know it, 2 months, 3 months, 4 months, 5 months, 6 months will pass, and the stone is still there, not passing. By the time you are doing water therapy and you are doing scans for 2 months, 3 months, 4 months, and the stone is not passing, that stone is not likely going to pass. The best thing to do is to see your urologist so that he can advise you properly on the treatment options. And good enough, we have treatment options for kidney stones that we can safely do for you without having to give you any single cut. Any single cut. Our laser therapy and other things are there for us to treat your kidney stones without giving any single cut. A lot of my patients, we do laser therapy for them and all that, and they go home very, very happy. So there's no need wasting your time and damaging your kidney. Go for the right therapy and you will thank us for it. Thank you very much for listening.